First dose syncope is characteristic of which alpha-1 blocker? Prazosin. Remember, prazosin, pass out. ACE inhibitor strictly contraindicated in pregnancy. Enalapril, all ACE EIs. Remember, enalapril, enemy pregnancy. Which ARB shows maximal AT1 selectivity and PPAR gamma activity? Telmisartan. Remember, telmisartan trim sugars. Direct renin inhibitor approved for hypertension? Aliskiren. Remember, aliskiren arrests renin. Calcium channel blocker causing gingival hyperplasia, nifedipine. Remember, knife gums grow. IV drug of choice for hypertensive emergency in pregnancy? Labetalol. Remember, labetalol labor safe. Which vasodilator releases nitric oxide via sulfhydryl groups causing tachyphylaxis? Nitroprusside. Remember, nitroprusside needs thiosulfate. Potassium channel opener causing hypertrichosis, minoxidil. Remember, minoxidil makes MAIN. Central alpha-2 agonist patch for resistant hypertension? Clonidine patch. Remember, clonidine calm patch. Which thiazide has longest half-life and proven CV benefit? Chlorthalidone. Remember, chlorthalidone champion. Beta blocker with NO-mediated vasodilation useful metabolic profile? Nebivolol. Remember, nebivolol, nice no. ACE cough is due to accumulation of which peptide? Bradykinin. Remember, bradykinin causes bark. Parenteral drug for aortic dissection combining beta and alpha blockade? Labetalol. Remember, labetalol lowers tear. Slow acetylators develop lupus-like syndrome with which drug? Hydralazine. Remember, hydralazine hydrates wolf. Angiotensin receptor neprilysin inhibitor for heart failure? Sacubitril, valsartan. Remember, sacubitril saves heart. Loop diuretic preferred in HTN with renal failure? Furosemide. Remember, furo flushes fluid. Doc for cyanide poisoning following nitroprusside infusion? Sodium thiosulfate. Remember, thiosulfate traps cyanide. Beta blocker with ISA safe in peripheral vascular disease? Pindolol. Remember, pindolol partial pulse. Vasodilator producing hyperpolarization by opening K+ channels without reflex tachycardia IV? Diazoxide. Remember, diazoxide drops pressure. Preferred antihypertensive in diabetic nephropathy? ACE inhibitors. Remember, ACE aids kidney. Sodium nitroprusside dilates arteries and veins by generating which gas? Nitric oxide. Remember, SNP sends no. Drug causing ankle edema due to precapillary vasodilation? Amlodipine. Remember, amlo ankle edema. Beta blocker of choice in thyrotoxic crisis lowering T3 to T4 conversion? Propranolol. Remember, propranolol prevents T3. Centrally acting alpha-2 agonist safe in pregnancy chronic HTN? Methyldopa. Remember, methyldopa maternal safe. ACIs are renoprotective by decreasing glomerular pressure, intraglomerular efferent dilation. Remember, ACE eases efferent. Combination of nitrates and hydralazine improves mortality in heart failure, especially in this ethnicity? African American. Remember, hydronitrate helps AA. Drug causing hyperuricemia, aggravating gout among diuretics? Thiazides. Remember, thiazide throws urate. Potassium-sparing diuretic acting as aldosterone antagonist? Spironolactone. Remember, spironolactone spares potassium. Adverse effect gynecomastia less common with which aldosterone antagonist? Eplerenone. Remember, eplerenone endocrine friendly. Doc for hypertensive encephalopathy with renal failure, nicardipine infusion. Remember, nicardipine neuro relief. Thiazide diuretics are ineffective when GFR are less than 30 milliliters per minute. Prosody rate 100%. Break time 500 milliseconds. Remember, below 30 thiazides fail. Which drug combination increases risk of hyperkalemia with ACIs? Potassium-sparing diuretics. Remember, ACE plus K saves peril. Phenoldiprem lowers BP by stimulating which receptor? D1 dopamine. Remember, phenoldiprem favors D1. Which vasodilator increases hair growth due to potassium channel opening? Minoxidil. Remember, minoxidil makes mane. ARBs do not cause cough because they do not inhibit breakdown. Bradykinin. Remember, ARBs avoid bradykinin. Doc for scleroderma renal crisis? Captopril. Remember, captopril crisis saver. Which antihypertensive can precipitate rebound hypertension if suddenly withdrawn? Clonidine. Remember, clonidine comeback crisis. Beta blocker with highest cardioselectivity? Bisoprolol. Remember, bisoprolol best beta 1. Hydralazine acts predominantly on arterioles or veins. Arterioles. Remember, hydralazine hits arterioles. ACI overdose causing severe hypotension, managed first with infusion, normal saline. Remember, saline saves ACE shock. Drug used in pheochromocytoma hypertensive crisis along with alpha blockers for tachyarrhythmia? Esmolol. Remember, esmolol event control. Bradycardia and hyperkalemia together suggest overdose of which antihypertensive? ACE inhibitor. Remember, ACE adds K slowdown. Which drug causes cyanide accumulation if renal insufficiency present? Nitroprusside. Remember, nitroprusside needs kidney. Alpha blocker beneficial in lipid profile, improving HDL to LDL ratio. Prazosin, prosody. Remember, prazosin perks lipids. Thiazide diuretics reduce calcium excretion, therefore prevent this stones. Calcium oxalate. Remember, thiazide thinks stones. ACE inhibitor with shortest half-life used IV for HTN urgencies? Enalaprilat. Remember, enalaprilat emergency IV. Drug causing contraindicated interaction, ACI+, resulting in renal failure and hyperkalemia. NSAIDs. Remember, ACE with NSAID, bad. Preferred antihypertensive in pheochromocytoma chronic therapy, phenoxybenzamine. Remember, phenoxy-pheo-prep. Long-acting dihydropyridine causing minimal reflex tachycardia due to slow onset, amlodipine. Remember, amlo avoids reflex. Remember, diazoxide drives glucose. Hydralazine is combined with beta blocker to prevent reflex-tachycardia. Remember, beta slows hydra heart. Speak. Which drug inhibits NaCl cotransporter in distal convoluted tubule? Thiazides, prosody. Speak. Remember, thiazide thwarts NCC. ARBs block AT1 but leave AT2 receptor free, causing non-effects. Vasodilatory. Remember, AT2 adds dilate. Doc for renovascular hypertension due to fibromuscular dysplasia. Percutaneous angioplasty. Remember, balloon beats band. Hyperuricemia is least with which loop diuretic? Toracimide. Remember, toracimide tames urate. Which antihypertensive requires cyanide detox co-therapy in prolonged infusion? Nitroprusside. Remember, nitroprusside needs thio. Minoxidil causes pericardial effusion because of salt and retention, water. Remember, Mini keeps water. First-line drug for isolated systolic HTN in elderly, thiazide diuretic. Remember, thiazide treats senior. Little syndrome HTN treated with epithelial sodium channel blocker, amiloride. Remember, amiloride anti-littles. Drug causing hair growth used topically for alopecia, originally antihypertensive, minoxidil. Remember, minoxidil main maker. Combination of ACI with ARB increases risk of failure, renal. Remember, double block damages kidney. Hypertensive emergency with eclampsia uses IV labetalol or R, hydralazine. Remember, Hydra handles eclampsia. ACI increases serum lithium due to reduced clearance, renal. Remember, ACE lifts lithium. Which methylxanthine antagonizes clonidine antihypertensive effect? Caffeine. Remember, caffeine counters clonidine. Drug causing reflex tachycardia among CCB is nifedipine because of rapid release onset. Remember, knife quick reflex. Speak, prosody rate 100%, potent vasodilator causing lupus-like syndrome at doses above 200 milligrams. Hydralazine. Remember, Hydra triggers lupus. Beta blocker preferred in COPD patient needing rate control. Bisoprolol. Remember, biso breath friendly. All thiazides cross placenta, safest antihypertensive in pregnancy, methyl-dopa. Remember, methyl-dopa mother safe. Excess renin due to renal artery stenosis contraindicates which antihypertensive class? ACE inhibitors relative. Remember, stenosis skip ACE. Drug of choice for pheochromocytoma chronic control, phenoxybenzamine. Remember, phenoxyphenoprep. Hydralazine acts via release of, from endothelium, nitric oxide. Remember, Hydra hands out no. Beta blocker with alpha-1 blockade reducing peripheral resistance, carvedilol. Remember, carvedilol cuts resistance. Which diuretic may cause ototoxicity when combined with aminoglycosides? Furosemide. Remember, furosemide fails hearing. Drug useful for hypertensive crisis in aortic dissection due to fast titration? Esmolol plus nitroprusside. Remember, esmolol SNP tartane. ACI can cause angioedema due to increased peptide, bradykinin. Remember, bradykinin balloons face. Which vasodilator opens both KATK channels in vascular smooth muscle? Diazoxide. Remember, diazoxide dilates channels. Labetalol IV ratio beta to alpha blockade? 7:1. Remember, labetalol 7:1. Thiazide-induced hypokalemia worsens when combined with which steroid? Prednisone. Remember, steroid sucks potassium. Which ACI is active drug, not a prodrug? Captopril. Remember, captopril comes complete. Arst oral once daily selective aldosterone antagonist reducing morbidity in HF? Eplerenone. Remember, eplerenone enhances life. Alpha-1 blocker causing least reflex tachycardia due to central suppression, doxazosin. Remember, doxa decent pulse. Drug causing taste disturbance among ACIs, captopril. Remember, captopril changes taste. Monitor serum lithium when starting diuretic, thiazide. Remember, thiazide lifts lithium. Beta blocker with shortest elimination half-life, 9 minutes, esmolol. Remember, esmolol exits fast. Drug class contraindicated with aliskiren in diabetics, ACIs or ARBs. Remember, aliskiren, avoid ACE-ARB. Dihydropyridines act mainly on vascular smooth muscle because they inactivate calcium channels, L-type calcium. Remember, DHPs down L channels. ACIs decrease aldosterone, thereby causing retention of which electrolyte? Potassium. Remember, ACE keeps potassium. Potassium channel opener used IV to maintain hypoperfusion in aneurysm surgery, nicorandil. Remember, nicorandil nourishes vessels. Hydrochlorothiazide, max effective dose in HTN beyond which effect plateaus, 25 mg day. Remember, 25 enough. Combination of ACI with dihydropyridine CCB shows outcome benefit in Accomplish. Drug names: benazepril plus amlodipine, prosody. Remember, ben plus amlo best. Which antihypertensive increases urinary sodium and calcium excretion loop site, furosemide. Remember, furosemide flushes ions. Reflex tachycardia prevented by combining nitrates with angina, beta blocker. Remember, beta blocks bounce. Low renin hypertension responds poorly to ACE inhibitors. ACE. Remember, low renin lousy ACE. Cenerenone is non-steroidal selective mineralocorticoid antagonist approved for kidney disease, diabetic. Remember, finerenone fixes diabetic. Natriuretic peptide neprilysin inhibition increases peptides except which rises BP, angiotensin II. Remember, neprilysin needs ARB. Discontinue ACIs days before bilateral nephrectomy, 1 day. Remember, stop ACE 1 day. Preferred beta blocker in chronic aortic dissection to reduce shear? Propranolol. Remember, PROP protects aorta. Aliskiren reduces plasma renin but increases renin concentration. Renin substrate prorenin. Remember, aliskiren raises renin level. First ARB discovered, but not used due to low bioavailability, losartan, prototype. Remember, losartan launched ARB. Drug of choice for HTN with benign prostatic hyperplasia providing symptomatic relief, tamsulosin or prazosin. Remember, tamsulosin treats 2.